Joining me now is Natalie Bubela with Muskoka Algonquin Healthcare. Natalie, thanks very much for taking the time to come in today.
My pleasure.
So we've had some stark news coming about, the projections of COVID-19 in the province moving forward, looking at almost 6,500 cases per day in Ontario as of mid-December. And that was also leading to a concern about hospital beds and rooms. Now, I know here in Muskoka, we haven't really seen the complexities of other areas in terms of COVID cases coming through, but obviously it's still a concern. So I just want to kind of see your perspective on that projection and how you're feeling right now about our hospital sites.
Sure. So maybe I could just start with saying that the types of volumes that we're seeing in our hospital right now, we're at overcapacity, is very different from what we saw in wave one. So we do have a number of people that have presented to the hospital that have serious enough illness that they've required hospitalization. So today, for instance, we're at 117% occupied at Huntsville, and 123% occupied at Bracebridge. So these are non-COVID related patients that are in the building. So very different scenario from what happened in wave one. Having said that, we do know that the volumes are going up across certain sectors of Ontario, and in preparation for that, we've begun doing some planning. So we've done planning and staffing modeling around intensive care. So should we be faced with a surge of patients that require hospitalization and ventilation, we've got a plan in place for that, and the appropriate triggers that would really show us what we have to do in terms of the level of complexity and the amount of patients coming through our doors. Our command center is still continuing to meet on a regular basis, and we are following direction from Ontario Health, Public Health, Ministry of Health, etc. And so all that's happening. We're also dusting off our Code Orange. So our Code Orange policy is around when demand exceeds the available resources. So we're having a good look at that right now as well, with a COVID-19 lens to that. I think another thing that people can take some comfort in is that we do have the regional pandemic unit that's available now at RVH. So it's the field hospital, the four-season field hospital that's been built. And its intent was to really provide additional capacity for hospitals that might need it in the Simcoe, Muskoka area. And so that's a 70-bed facility. And the plan there would not be to house COVID-19 patients, but to house more sort of a medical type of a patient that would require hospitalization if we don't have the capability of looking after them because we're full.
So, from the projections right now, from the reports, I see there's still one person listed in our area in hospital. How does that sort of, because, capacities aside, you still have to make room and space for these patients that to separate them from the general population, right? So how does that play in with the issues that you have with capacity already, trying to make room for them?
Yeah, so what we've done, so that's a great question. What we've done is we've created specialty units at each of our sites to house any people that are under investigation and require isolation. And if they also then become, or we find out that based on that testing that they are COVID positive, they would remain in that area. So it's all single rooms. What we're also doing is we're renovating additional space in each of our hospital sites to create more private room for people in case they come in and we need the space.
This is a curiosity that I have, and just wanted to take a sidestep here. We're looking ahead to building new hospital sites, right? Does COVID-19 now play a role in planning how those sites are being built?
Absolutely. We did, our planning up to that point when we submitted to the Capital Branch did have infection control guideline lens on it. But I would say now that we've been into this pandemic, we definitely have to dust those plans off again and really have a good look at them. So at this point, the planning is more blocks. So a block for diagnostic imaging, a block for surgery, etc. And I think it's going to be really important for us to go back and look at that to make sure that the sizes of those blocks in our next stage of planning is actually sufficient, so we can incorporate things like ante-rooms, for instance. Do we have the right flow of air and negative pressure in the building, that type of thing.
Okay.
So it will absolutely impact the way we plan into the future.
I mean, hopefully by the time that those hospital sites are built, we're going to be way out of this pandemic. But I mean, there's always an opportunity for this to happen again, right? So good to think ahead. And you were mentioning other departments. That's a good kind of segue into what I wanted to ask as well. What is happening right now with these other departments, with these other services that are being provided by the hospital sites? Are they still kind of status quo at the moment?
So every service that was paused at the beginning of the pandemic is pretty well back up to what it was pre-pandemic.
Okay.
One of the areas that we're still not quite where we want to be would be in diagnostic imaging. And that's really largely related to some staffing shortages in the diagnostic imaging area. So absolutely trying to get everything back up, and we've really achieved that. So we've got our rehab going on, we've got our diabetes education continuing, we've got x-ray occurring up in Brooks Falls. So pretty well everything is back to what it was pre-pandemic.
Should we be concerned that that might slide back again as these numbers start to go back up? Because we're hearing from Minister Elliott that those are types of things that would be sacrificed as the numbers go up.
So we're hoping, as I mentioned earlier, that all the other planning we're doing is going to be put into place first. So the Code Orange, the staffing modeling that we've been doing, the visitor restrictions that we have, except for essential visitors. We would be looking at all those things first, but it is possible that we might have to pause or scale back some of the services we're currently providing if we have to redeploy staff.
Okay. Natalie, anything else you'd like to add while I have you in studio? I know we've chatted a few times. Anything messaging you want to give on behalf of the sites right now?
Well, I think a really important message I want to give is everyone has to play their part, and really strongly encourage people to take this seriously, to physically distance, to make sure that you're wearing your mask if you're out in public. Wash your hands frequently, stay within your bubble, and don't go out if you don't have to, really. And then I think as well, what I'd like to say is I really want to thank our hospital heroes. Our credentialed staff and our frontline staff and all staff in the hospital have done an amazing job through our pandemic. And I just really want to recognize them and thank them for what they're doing.
Fantastic. Natalie Bubela, thank you very much for taking the time again today.
You're welcome.
Appreciate it.